What about robotic surgeries? Which cancers are they used for? How beneficial is it for patients when it comes to, say, reduced blood loss as well as recovery when it comes to robotics?
Yeah.
And how often is it used in India considering how expensive it is?
Well, firstly, let me take the last point first. It it is expensive, but not prohibitively expensive. And I think there are, for those cases where it is indicated, it is very well worth it, because for the patient, it means, like you pointed out, very quick recovery, very good dissection, very safe, and very quick return to normal, so return to productivity. Now, for instance, the entire field of urologic oncology, whether it is for kidney, whether it is for prostate, also to an extent for urinary bladder, they are I mean, robotics has taken over in a big way. Yes, there are those patients, the advanced cases, who will need open surgery, but robotics has taken over in a big way. Another area, robotics really works very well when you're working in a cavity. So whether it is the abdominal cavity, the pelvic cavity, or the thorax. For example, I just said prostate. Prostate is a pelvic organ, and the open prostate surgery used to be one of the worst and most morbid surgeries in the past. And today those patients go home in 48 hours. So it's a huge advance. And I think there's no question about it. It is there to stay.
Okay.
Yeah.
All right. Dr. Raja, coming to you now, what is precision medicine or targeted therapy in terms of cancer? Is it for all stages of cancer, and is it for all cancers?
Yeah, absolutely. So precision oncology is probably the best thing that has happened over the past decade, in which we understand that each patient with their tumor is unique in their own sense, and each one of them have to be treated according to their tumor and tumor DNA profile and so on and so forth. No two individuals, even with the same diagnosis, are same. That's what we understand by precision oncology. We tailor the treatment to the individual, to the tumor. That's known as precision oncology. It is when it was first brought into in the year 2000, liquid malignancies like chronic myeloid leukemias, and later on by 2010, lung cancers became an important example for how precision medicine can be applied in solid tumors. At that time, it was usually applied for advanced malignancies, stage 4 malignancies. But the best thing is that now it is being increasingly used for even for early stage diseases, even for post-operative situations, or even in pre-operative situations. Now we use these kind of approaches, and the outcomes and the long-term survival has tremendously improved. So precision oncology is applied across all stages in across many malignancies currently.
Okay. Dr. Raja, what about CAR-T therapy? There is one particular CAR-T therapy which has been introduced recently in India, which is by ImmunoAct. It's indigenously made. How much is it used, and what is the price difference as well?
A very important advancement in our country, because this is developed by our own in our own country by one of the biotechnology company, and this has suddenly made the this particular treatment option available to our population. uh, just before 2 years, all of our patients have to travel to other countries, including United States, or to Eastern, some of the Eastern developed countries, to get access to this particular treatment. But fortunately, over the past 2 years, in our center and many other centers, we started doing clinical trials on with CAR T cells in particularly in lymphomas and leukemias, and the treatment started to become available. Now we have this, NexCAR19, which is an approved option available, developed in our own country. Currently, it's approved for lymphomas, B cell lymphomas, but I think it is also being increasingly researched in leukemias. acute lymphoblastic leukemias, and in multiple myelomas. Very soon, all these diseases will come under the purview of CAR-T cell therapy. It's a very important development because it's now an important option for patients who have already become refractory or relapsed to the previously existing therapies, wherein previously there were no options, and this has suddenly become a curative option in those settings. Cost is a
Okay,
very important issue, but what has happened with the development of technology in India is that the cost has tremendously come down.
sure.
The cost that was 3 crore to 4 crore in the other countries has now come to 40 lakhs, 50 lakhs by the availability of this particular option in our country.
For more news and updates, all you need to do is follow CNBC TV 18 on all of our digital platforms.